Real cases. Let's talk about people who had a serious brain problem. Jessica, who had just had a baby, suddenly couldn't speak properly or walk. Hugo, who was very worried about money, had such a severe headache that he passed out and needed surgery. Regina was at a party when she felt her face tingle. All these cases are of people who had a problem called a stroke. Overview of stroke. A stroke, or cerebrovascular accident, CVA, is a serious problem that affects the brain. When a person has a stroke, part of the brain may stop receiving blood as it should. This happens because of a blockage in an artery, which carries blood to the brain, or due to a blood leak within the brain. Imagine the brain as a large city full of roads and streets. Blood is like the cars that carry important things to all parts of the city. If one of the roads or arteries gets blocked, the cars can't reach where they need to go. Similarly, if a road bursts and starts leaking, it can cause a major problem in the city. When the brain doesn't receive enough blood, brain cells start to die very quickly. This is serious because brain cells are responsible for many things we do, such as speaking, walking, remembering things, and even thinking. That's why it's crucial to act quickly when someone is having a stroke, to try to save the brain cells and prevent permanent damage. Time is essential in stroke treatment. The faster the person receives medical help, the better the chances of minimizing damage and improving recovery. That's why it's so important to know the signs of a stroke and know what to do if someone near you shows these symptoms. Early recognition of stroke symptoms is crucial for ensuring rapid and effective treatment, which can save lives and reduce permanent brain damage. When someone is having a stroke, some sudden changes in the body may indicate a serious problem in the brain. Sudden dizziness. The person may feel like they are spinning or losing balance suddenly, even without an apparent reason. Impaired motor coordination. It may be difficult for the person to move an arm or leg in a coordinated manner. They may not be able to hold objects or perform simple movements. Severe and rapid onset headache. A severe headache that comes on suddenly and may be described as the worst headache the person has ever felt. Tingling in arm or leg. A sensation of tingling or numbness on one side of the body, which can affect an arm, leg, or even half of the face. Weakness on one side of the body. The person may feel sudden weakness in an arm, leg, or even one side of the face. This may be accompanied by a feeling of heaviness or inability to move the affected part. These signs can appear suddenly and are generally not normal. If someone you know exhibits these symptoms, it's essential to act quickly. Call for medical help. Call emergency services immediately. Time is crucial for stroke treatment, and every minute counts to minimize brain damage. Pay attention to symptoms. While waiting for medical help, carefully observe the symptoms and note any additional changes. This can help healthcare professionals better understand what is happening when they arrive. Don't wait for symptoms to pass. Sometimes, people may ignore symptoms like dizziness or tingling, hoping they will go away on their own. In the case of a stroke, this wait can be dangerous and increase the risk of irreversible damage. It is important to educate yourself and those around you about the signs of a stroke. This can make a significant difference in how quickly treatment is initiated and in the outcomes for the affected person. The SAMU technique is a simple and effective way to identify signs of a possible stroke and act quickly to get medical help. Here are the main steps of the SAMU technique. Smile. Ask the person to smile. Observe if the smile is even on both sides of the face. If one side of the face appears to be drooping or the smile is uneven, this may indicate a neurological problem, such as a stroke. Raise arms. Ask the person to raise both arms at the same time. If one of the arms is weak, heavy, or cannot be lifted normally, this could be another sign of a stroke, especially if it happens only on one side of the body. Simple speech. Ask the person to say something simple, like their full name or sing a familiar song. Observe if the speech is strange, slurred, difficult to understand, or if the person is having trouble forming words correctly. If you notice any of these signs during the SAMU technique, it is crucial to call emergency services or the local emergency number immediately. Inform them of the symptoms you observed and follow their instructions while waiting for medical help to arrive. Using the SAMU technique can help quickly identify a stroke and initiate the necessary treatment as soon as possible, which is essential to minimize brain damage and improve the chances of recovery for the affected person. The types of strokes are mainly divided into two. Ischemic stroke. In this type of stroke, an artery in the brain becomes blocked, preventing blood from reaching a part of the brain. It's like a pipe getting clogged, and the area of the brain that doesn't receive blood starts to die quickly due to the lack of oxygen and nutrients. This type of stroke is the most common, accounting for about 85% of all cases. It can occur due to the formation of a clot at the site, thrombosis, or a clot that forms in another part of the body and travels to the brain, embolism. Hemorrhagic stroke. In hemorrhagic stroke, an artery in the brain ruptures, causing bleeding within the brain tissue or the areas around the brain. This can occur due to the rupture of a weakened blood vessel, such as an aneurysm, or other conditions that increase pressure on the blood vessels in the brain. This type of stroke is less common but generally more severe and potentially fatal, as the bleeding can cause significant damage to brain tissue. Both types of stroke are medical emergencies that require rapid treatment to minimize brain damage and improve the chances of recovery for the affected person. Identifying the type of stroke is essential to determine the appropriate treatment and necessary measures to prevent additional complications. A transient ischemic attack, TIA, is a medical event that can occur before a full stroke. It is considered a mini-stroke because it presents symptoms similar to a stroke but usually lasts only for a short period, generally less than an hour. TIA symptoms can appear suddenly and disappear quickly, sometimes within minutes. The main symptoms of a TIA are similar to those of a full ischemic stroke and may include weakness or numbness, usually on one side of the body, such as an arm, leg, or half of the face. Difficulty speaking. The person may have trouble speaking clearly, finding words, or understanding what others are saying. Vision changes, double vision, partial or total loss of vision in one or both eyes. Dizziness or loss of balance. There may be a sensation of dizziness or difficulty maintaining balance while walking. Sudden headache. Sometimes, an intense and sudden headache can be a symptom of a TIA. It is crucial not to ignore TIA symptoms, as they can be an early warning sign that a full stroke may occur soon if preventive measures are not taken. Even if the symptoms quickly disappear, it is important to seek immediate medical attention to investigate the cause of the TIA, identify underlying risk factors, and prevent a future stroke. The causes of stroke can vary, but they are generally related to conditions and habits that affect vascular and brain health. Here are some of the main causes. High blood pressure. Hypertension. It is the most significant risk factor for stroke. High blood pressure damages the walls of arteries over time, increasing the risk of blockages or ruptures in the blood vessels of the brain. Smoking. Smoking increases the formation of plaques in the arteries and raises the risk of blood clots, which can lead to a stroke. Heart problems. Conditions like cardiac arrhythmias, such as atrial fibrillation, can cause clots that travel to the brain and block blood flow. Diabetes. Uncontrolled diabetes can damage blood vessels over time, increasing the risk of stroke. Sedentary lifestyle. Lack of regular physical activity can contribute to the development of conditions such as obesity, high blood pressure, and diabetes, all of which are stroke risk factors. Obesity and poor diet. Excess weight puts additional pressure on the circulatory system, and a diet high in saturated fats, salt, and sugars can raise cholesterol levels and contribute to plaque buildup in the arteries. Family history. People with close relatives who have had a stroke are more likely to develop the condition, especially if there is a history of hemorrhagic stroke. Excessive alcohol and drug use. Excessive alcohol consumption can raise blood pressure and the risk of cardiac arrhythmias, while illicit drug use can contribute to increased blood pressure and the development of conditions that lead to stroke. Taking care of cardiovascular health through healthy habits, control of chronic medical conditions, and reduction of risk factors is essential to prevent a stroke. Awareness of risk factors and adopting a healthy lifestyle are important steps to protect the brain and reduce the risk of stroke. The increase in strokes among young people is a worrying trend linked to various lifestyle and health factors. Here are some important points about this phenomenon. Emerging risk factors. Many young people are developing risk factors for stroke that were traditionally associated with older individuals. This includes high blood pressure, diabetes, obesity, and elevated cholesterol levels, all contributing to the increased risk of stroke. Modern lifestyle. The contemporary lifestyle, characterized by unhealthy diets, physical inactivity, and high stress levels, significantly contributes to the development of these risk factors among young people. Smoking and drug use. Smoking and illicit drug use among young people are also significant risk factors for stroke due to their effects on the cardiovascular and vascular systems. Profound impact. A stroke can have a devastating impact on a young person's life, disrupting educational, professional, and social goals, and requiring significant lifestyle adaptations and long-term healthcare. Awareness and prevention. It is crucial to raise awareness among young people about stroke risk factors and promote healthy lifestyle habits from an early age. This includes a balanced diet, regular exercise, weight control, not smoking, and effective stress management. Early medical intervention. Recognizing stroke symptoms quickly and seeking immediate medical help is essential to minimize damage and improve the chances of a full recovery, especially in young people who may not easily recognize stroke signs. The increase in stroke cases among young people serves as an urgent reminder of the importance of taking care of cardiovascular health early. With proper education and positive lifestyle changes, it is possible to significantly reduce the risk of stroke and its devastating consequences. When someone suffers a stroke, immediate treatment is crucial to minimize brain damage and facilitate recovery. Here is some detailed information on the available treatment options. Medication treatment. For ischemic strokes, which are caused by a blockage in a cerebral artery, doctors may administer thrombolytic medications, such as TPA, tissue plasminogen activator, intravenously. These medications help dissolve the clot and restore blood flow to the brain. It is crucial to administer these medications within a limited time frame after the onset of symptoms, usually up to 4.5 hours, to be effective. Endovascular procedures. In some cases, more direct intervention may be needed to remove the clot. This can be done through endovascular procedures, such as mechanical thrombectomy. In this procedure, a catheter is inserted into the artery to reach and remove the clot in the brain, thus restoring blood flow. Emergency surgery. In cases of hemorrhagic stroke, where there is bleeding within the brain due to the rupture of a blood vessel, immediate surgical intervention may be required. Surgery may be performed to repair the ruptured blood vessel or remove the accumulated blood in the brain, relieving intracranial pressure and preventing further damage. Rehabilitation and long-term care. After the initial treatment, recovery from a stroke often involves intensive rehabilitation, which may include physical, occupational, and speech therapy. These programs aim to help stroke survivors regain lost skills and improve their quality of life. Prevention of recurrent stroke. In addition to initial treatment, implementing preventive measures to reduce the risk of a second stroke is crucial. This includes effective management of risk factors such as high blood pressure, diabetes, high cholesterol, and unhealthy lifestyle habits. Importance of rapid response. In all cases of stroke, quick medical response is essential. Every minute counts, as lost time means more damage to brain tissue. Recognizing symptoms early and calling emergency services immediately can make a huge difference in the outcome and recovery of the affected person. With ongoing advances in medicine and technology, stroke treatment options have evolved, offering better chances of recovery and reducing long-term complications. However, public awareness of stroke signs and the importance of rapid response remains crucial to saving lives and minimizing long-term effects. Stroke prevention is key to reducing the risk of one of the leading causes of disability and death worldwide. Here are some important strategies to help with prevention. Blood pressure control. High blood pressure is a significant risk factor for stroke. Regularly monitoring blood pressure and following medical recommendations to keep it within healthy levels can help reduce this risk. Quit smoking. Smoking significantly increases the risk of stroke, as well as being harmful to cardiovascular health in various other ways. Quitting smoking is one of the best things someone can do to reduce the risk of stroke and improve overall health. Healthy eating. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help maintain cholesterol and blood sugar levels under control, thus reducing the risk of developing conditions that can lead to a stroke, such as diabetes and heart disease. Regular exercise. Regular physical activity not only helps control body weight, but also contributes to overall cardiovascular health. At least 150 minutes of moderate aerobic activity per week, such as brisk walking, is recommended for most adults. Stress management. Chronic stress can contribute to hypertension and other stroke risk factors. Learning stress management techniques, such as meditation, yoga, or simply taking time for relaxing hobbies, can help reduce this risk. Weight control. Being overweight or obese is associated with an increased risk of stroke, especially when combined with other risk factors like high blood pressure and diabetes. Maintaining a healthy weight through diet and exercise can reduce this risk. Regular health checkups. Regular visits to a doctor for preventive health checkups can help identify and manage stroke risk factors, such as high blood pressure, high cholesterol, and diabetes, before they become serious problems. Limiting alcohol intake. Excessive alcohol consumption can raise blood pressure and increase the risk of stroke. For those who choose to drink, it is important to do so in moderation and within recommended limits. Stroke prevention is a matter of healthy lifestyle choices and constant vigilance regarding risk factors. By adopting these preventive measures, it is possible to significantly reduce the chances of having a stroke and enjoy a healthier, fuller life. In conclusion, understanding stroke, its symptoms, risk factors, early recognition techniques, and treatment options is essential for acting quickly in an emergency. Promoting awareness about prevention, emphasizing the importance of healthy lifestyle habits such as blood pressure control, proper diet, regular exercise, and quitting smoking is crucial. Prevention not only reduces the risk of stroke, but also improves overall cardiovascular health. With continued education and access to proper medical care, we can work to reduce the devastating impact of stroke on people's lives and communities. If you enjoyed this video, please subscribe to the channel, like the video, and share it with those who need to know. See you soon.